Hello and good day to every one of you. My name is Mr. Abasa Glory. So let's go straight to answering the first question we have. A client is admitted with right lower quadrant pain, nausea and temperature of 100 degrees Fahrenheit. What does the nurse expect will be done initially? So a patient having right lower quadrant pain, having nausea and temperature hike, two things are coming to our head, right? We're going to ask yourself, what organ do we have at the right lower quadrant? Right lower quadrant. That if it occurred, there will be nausea, there will be increase in temperature. What could be an organ that is found at the right lower? Of course, the first thing that want to come to your mind will be appendicitis. So it is possible the patient is having appendicitis. So a patient who is having appendicitis, assuming it is appendicitis, and now temperature is high, having nausea, what does the nurse expect to be done initially? Number one, X-ray of the abdomen. Will X-ray of the abdomen be the first thing to be done? A patient who comes to the hospital and present these symptoms, is it X-ray? Will X-ray be the first thing the doctor will order? Do you think so? Let's hold on. Number two, deep palpation of the abdomen. Somebody complained on right lower quadrant. Is deep palpation the first thing that will be done for this individual? Let's hold on. Blood drawn for complete count. Blood drawn for complete count. Do you think blood count will be the first thing they will order for somebody who's having right lower quadrant pain? Now, next, administer a tap water enema. Administer a tap water enema. Do you think water tap enema will be the first thing that a patient who's having appendicitis? Do you think that's the first thing that will be done? Now, what we must understand here is that they need to do history taking because the patient have manifested signs and symptoms of appendicitis. So, as a medical personnel, you need to do assessment before anything at all. So, it therefore means that from the signs and symptoms we have is possibility of appendicitis. So, what do we need to do? Knowing fully whether we have enough information that we're telling us the patient is having appendicitis. Now, if you look at all of them, the only thing that is bringing assessment here is number two, deep palpation of the abdomen. And in talking about deep palpation of the abdomen, we know according to rule of physical examination that when it comes to abdomen, you don't do abdominal palpation as the first thing. You don't do abdominal palpation as the first thing. So for a patient who have having appendicitis, X-ray will not be the first thing that will be done. Two, deep palpation of the abdomen will not be the first thing to be done. Other things need to be done first before deep palpation. Three, administration of enema will also not be the first thing to be done. Which means that the first thing at all the doctor may order is to go and do your blood count. Why do we do blood count? We want to know if it's an inflammation or an infection. Because blood count will reveal increased white blood cell. And of course, we know increased white blood cell could be the possibility that is an infection in the system or inflammation that occurred. So the best option to this question is number three. Blood will be taken first to know the blood count before X-ray may not be needed. Enema may not be needed because enema, if at all the appendix is matured or it can cause rupture of the appendix. So also deep palpation may also cause rupture, but that becomes the last thing to be done after blood count. So the answer to the question is blood count. Thank you. Okay, so let's move straight to number two. The licensed practitioner nurse on a medical unit observe a coworker taking diazepam order for a client. A licensed practitioner nurse on a medical unit observe observe a coworker taking diazepam order for a client, what should the nurse do initially? Now you see that a coworker is taking diazepam for a client, taking order for diazepam for a client. What should the nurse do initially? Now what you must understand here is that diazepam is a restricted drug. It is not over-the-counter medication. So it is a restricted medication. So now you see a colleague taking order of diazepam for a client. The question is, what should the nurse do first? Number one, immediately call the supervisor. Number two, confront the nurse. Number three, observe the nurse for unsafe behavior. Number four, administer that nurse's medication for the rest of the shift. Now, one of the rules you must understand here is that when you are seeing a colleague doing something wrong, the rule says if what the patient is doing, what the colleague is doing, it is illegal, report immediately. If what he's doing is not illegal but harmful, you should confront. If it's not illegal and not harmful, what should you do? You tell later. So taking diazepam order, it is an illegal act. So the rule says you should call your supervisor immediately. That's to say, you should report them. So the best option for this question is number one, immediately call the supervisor. You don't confront them. You don't confront them because they can deny it. It can lead to argument. Number three, observe the nurse. It can harm the patient. It can harm anybody. So you don't observe. So also you cannot administer the nurse's medication for the rest of the day or the rest of the shift. So the best option is number one, immediately call the supervisor. Thank you. Straight to the question, my name is Mr. Abbasagluri. A mother called the pediatrician office stating that her 15-month-old son received an MMR vaccine yesterday. Today, the site of the injection is red, warm, and puffy. What is the best action for the nurse to take? The patient had the 15-month-old child receive an immunization yesterday. That is a vaccine. Now, today, the site of the injection is red, warm, and puffy. What is the best action for the nurse to take? Now, everyone on this group I saw made good attempts, so everyone got the answer. But let's just review it. Now, report the symptom to the physician as an adverse reaction. 2. So, is that the best thing the nurse is supposed to do? 2. Suggest the mother apply a warm compress every 2 hours. Is that the best option? Place that is hot, red, warm already. Advise the mother to give her baby aspirin. Now, next, explain to the mother that this is an expected response. Now, what you must understand here is that vaccine is given, so which means an injection was given. An injection, of course, one of the major signs and symptoms of inflammation is red, warm, and swelling, which is a normal reaction of inflammation. That injection will cause inflammation, which is a normal reaction. Imagine when you use needle to prick yourself, the place will be red, to be hot, to be swollen. However, reported to the physician as an adverse reaction is out of the way. They didn't tell us the child was having fever, was having other symptoms. So number one is out of the way. Suggest the mother apply a warm compress every 2 hours. You cannot apply warm compress at this time. What you're supposed to apply, if at all, is cold compress, not hot compress. So number 2 is out of the way. I advise the mother to give her baby aspirin. You don't give aspirin to children, especially 15 months old. You don't give aspirin to them because of liver issue. So that's one of the major issue. So number 3 or number 4, explain to the mother that this is an expected response. Yes, it's an expected response of inflammation. So there is nothing to worry about. So the answer to the question is 4. Thank you.